what would be like, if somebody were to ask you today, or me were to ask you the merits of genetics testing for this movement in precision health, is a genetics test essential for that? And if so, what are some of the insights that people should expect to glean out of that?
Okay, overall, I'm excited for the field. I think that genetics does play an important role in personalized medicine and nutrition. That said, most of the genetic interpretation tools out there um, do a very not a very good job.
You could say poor job. It's okay.
Thank you for translating my hesitation. A poor job, yes, a poor job in really explaining what is the evidence of that information, and whether, and the chances that information applies to the customers. What I mean is that, for example, even for in the low carb and low fat fields, there are many reports that tell you, you have this variant in PPAR alpha, and this is a contraindication for a high-fat ketogenic diet. Based on what? Based on observational studies that link this variant with the bad blood lipids in the context of a high carbohydrate diet with the high fat intake. Mm-hmm. And then, I don't know this, that you are telling me this information based on basically no evidence, mm-hmm. evidence of this. And it's very bad. So what I'm actually working on several projects where I'm looking at different genetic pathways, inflammation, cardiometabolic, detoxification, and narrowing down on the genetic variants that have been tested in people in intervention studies. So there is a difference between observational studies and intervention study, but when you know which subpopulation are you looking at, which intervention, whether they had the benefit. And only if we do that, we can come with a score of strength of evidence for that association, so that clinicians and people can use it and know how strong is the evidence. Okay, it's convincing, it's possible, and for which people, in which context. Otherwise, we are just, it's nice to gamify this field, and but other than that, people need to be careful. For example, I always say that 23andMe predicted that I'm very likely to have straight hair. Look at me. So it's and there is a reason for that. I mean, because complex traits like hair, your hair, or also your response to a diet, are really reflects the interaction of thousands genes together. And 23andMe is testing 1 or 2 or 3 or 10, and that's not enough. And the same is with ApoE. 23andMe tells you that, I think it's nice to know your ApoE status.
Yeah.
At the same time, it's scary that they don't counsel people, and this